In my practice setting, it is not uncommon to see patients with known ascites. They will often have related complaints of abdominal pain, fever, or shortness of breath, all requiring me to perform a diagnostic and/or a therapeutic paracentesis. While not necessary, I would strongly encourage you to use ultrasound to guide your procedure. For me, there are a few major advantages of using ultrasound to guide your paracentesis. Number 1, location. If I plan on doing this procedure, I can look at multiple different locations to figure out which is the optimal choice. Where is the most fluid? Where are there no bowel structures or vessels, especially by epigastric vessels, which you'll want to identify using ultrasound prior to performing your procedure. Traditionally, there are 3 locations that you can pick from: the right lateral gutter, the left lateral gutter, or midline by your linea alba. The second major advantage is you're able to quantify your fluid. How much fluid or ascites is actually present? Often what I will do is start by using my low-frequency probe, either your phased array or your curvilinear probe, to evaluate for fluid. Perhaps you want to do a diagnostic paracentesis procedure to check for an infection. Before doing so, I'll actually check the various locations to see if there is, in fact, enough fluid present for me to safely perform my procedure. In this image, obtained by a low-frequency phased array probe, you can only see a small amount of ascites. You also see lots of bowel or intestine within your ascites space. This would not be enough of a pocket for me to consider safely doing a paracentesis procedure. How about here? Here there's probably a moderate amount of ascites. Again, take note of where your bowel or intestines lie. How about here? Here there's a very large amount of fluid, and your intestines are safely out of the way. Once you've identified a pocket that you're satisfied with, I would encourage you to now switch your probe from a low-frequency probe to a high-frequency linear probe. Performing your procedure with a high-frequency probe will offer you the optimal resolution. Before you start your procedure, you want to actually measure out that you have at least 2 centimeters of a safety zone before you have any bowel or intestines in your way. You can perform your paracentesis either using your static technique, where now that you've identified your pocket of fluid using ultrasound, your ultrasound probe can now be put down and you would proceed with your procedure using normal technique, or dynamic, where you would continue to use your ultrasound and visualize your needle as you aspirate the ascites. Here's an example of what a dynamic approach will look like. We are performing an in-plane technique where we can visualize the needle in its entirety, including the tip. Once our needle tip is within our ascites fluid, we should be able to safely and easily aspirate it back. If you're choosing to perform your procedure using the midline approach by the linea alba, make sure you don't have a distended bladder like this, but instead have your patient empty their bladder. This way, you will be sure not to cause any injury to your bladder or accidentally perform a bladder biopsy.